Very long time.
Welcome, everyone, to the CT Nurse Wellness Project Live Spotlight. I am Dr. Wendy Garber-Mayo. I am the founder and creator of the CT Nurse Wellness Project. This is a statewide movement dedicated to making nurse wellness top priority in every healthcare organization, school of nursing, and workplace where nurses serve. Today, we have with us Heather. Heather, I would like to take a moment for you to introduce yourself to our viewers.
Sure. I'm so happy to be here. My name is Heather Bezerra, and I am a master's educated nurse, freshly in August from Quinnipiac University. And I am a glutton for punishment, I guess. So I continued on straight to get my doctorate also from Quinnipiac. So I'll be finishing that in May of 27. Been a nurse for about 15 years and worked all over the world and as an Air Force nurse as well. So I've been kind of through it all, inpatient, outpatient, all kinds of different nursings. So I'm very passionate about nursing, very passionate about the profession as a whole. So I'm really honored to be here. And I do apologize if you hear anything in the background. I am at work, so you might hear background noise. I apologize.
Oh, yeah, no, that's fine. That's fine. Heather, since you've been a nurse for a long time, you have a lot of experience. You've been in a lot of different sectors of nursing. In terms of wellness, tell me what your thoughts are on wellness in nursing. How are we doing as a profession in terms of nurse wellness?
So I think we are actually improving. So I started in 2010 and it was in patient nursing. So I definitely worked really hard all the time. And it was in that time where it was almost like that rite of passage where, oh, well, you had that many patients. Well, I had this many. And you had this happen. And well, I had this. And, oh, I didn't get to sit for a lunch. And it was just that was just the norm. And so I've been out of that inpatient setting for a little while. But I think from what I've heard with the younger generation coming up and advocating for themselves a little bit more, and the nurse leaders understanding that oxygen mask concept a little bit better, I think we're getting better. We're nowhere near where we need to be. And I don't even know where we need to be really yet, because it is that balance of you have to take care of the patients. You're not there to like have yourself treated, right? But you're also not supposed to completely run yourself into the ground. So we're progressing for sure.
Yeah. I think you're so right in terms of being there for the patients, but I think as nurses and you know, my experience, I've been a nurse for over 20 years. I've been in different areas of nursing. Mm-hmm. And when I think about like stress, right? Stress is it's kind of like a cornerstone in nursing. I think about, you know, stress from the point of when I started nursing. The nursing program is so rigorous, very stressful. Yes. You're doing a lot, clinicals, this, that. Where when I was in school, I didn't have any class, session, program, webinar, workshop on self-care, wellness, how to manage your stress. Now we had time management, but it starts there. And then from school, you're launched out into the workforce where you go to orientation. No one's talking about stress management, wellness, how to take care of yourself. Then you get on the floor and, you know, it's like, you just got to go and take care of patients. But in our careers, there's no stopping point to say, okay, hey, check in. This is what you need to do for yourself, opposed to this is what you need to do for patients. And I think it is shifting a little bit, but I don't think we're quite there yet.
No. Learning how to debrief and put in patient safety reports, I think, is a really stringent, like, I don't really want to say stringent, but I think that's like a way to kind of help check it a little bit more without being too fluffy. Because if we can create that system where it's not a bad thing to say that you messed up, if we mess up as nurses, there is a reason for that. You know, obviously, yes, we're human, but that humanity comes out when something's off. Right? Because if we're prepared clinically, if we've been oriented to where we're working and an error occurs, something happened.
Yeah.
You know? And I think that's oftentimes tied to poor self-care. We're just spread too thin.
Yeah.
And I've utilized that because this job I'm in now is my first true management and leadership position. And I've tried to utilize that a lot. If there's an error, first I have to create a system where people want to come and tell me that they messed up. And then when they mess up, we stop and say, okay, hold on. One of my best examples is when we had one of our nurses do an EKG on the wrong patient. And I stopped and I said, okay, I have to put in a patient safety report because we did do the wrong care, right? Thankfully, nothing bad came of an EKG. But then I talked with my staff and I said, why did this happen?
Mm-hmm.
And we figured out that the nurse that did it, she was stressed about something personally.
Mm-hmm.
And she was trying to power through and just called the wrong patient back. And I said to my other nurses, we got to watch for each other. If you can tell that that nurse was not okay, we have the luxury in the job that we're in to be like, hey, go take a walk. We got you. Yeah. I know that's not always the case in every place, but maybe it needs to be.
Yeah. You bring up a good point, and I love that you said leadership, because leadership has a lot to do with curating the environment for nurses to feel safe. Psychological safety is a huge thing, and leaders are in the positions to really create that environment where a nurse can say, hey, I messed up, opposed to trying to hide it. But so leaders are also stressed.
Oh, yeah.
Leaders are very stressed. Leaders also need to take care of themselves. They have a lot going on. And then you also mentioned something about the nurse having something personal going on. What I see in terms of the CT Nurse Wellness Project, it's about the nurse as an individual, not just the nurse in the workplace, but you as a individual. Yes, because you need to learn how to manage yourself at work and at home, so important. So talk to us a little bit about what are the stressors you're seeing and or experiencing with nurse leaders?
Oh, okay. I could talk about that. Let's see. So I'm in middle management, and I feel like that has to be one of the hardest places to be. So, for example, today, our top nurse at our facility sent an email down to all of the nurse leaders and said, hey, for some reason, our facility is exponentially worse at importing influenza vaccines from the outside than the other facilities in our area. We need to fix that. And so she just drops it on us, and it's like, well, hold on. Have you done other research on this? So, sometimes the top nurses, they have to report to certain things, and then they just kind of drop it on all of us to figure it out. And it's like, but we don't even have all the information yet. Like for me, my first thought with this example was, well, maybe we're actually giving more vaccines here locally, and there just aren't as many from the outside. I don't know. It's quite fresh. It's a very fresh example. But we're squeezed and pressured and stressed from the top. And then from the bottom, what I find is I have my nurses who think they know the big picture of what's going on, but they have no idea. All they really care about is their little world. And that's fine. And that's normal. But when they come to us as managers and leaders and kind of dump everything, thinking that it's bigger than it really is, it becomes really difficult to deal with, because it's like, hold on, I can't just tell you everything that I know. I have to know my audience, but I also need to tell you enough to get you to understand your place, kind of thing. Mm-hmm. Mm-hmm. And so I do find that there's a lot of silos too, where, people are working independently. In our department, I work in telehealth, is very siloed, but yet we have to talk to each other. And so I'm finding that, I just talked about this today, efficiency and communication, you think they walk together, but they don't always.
Yes.
So that's a big stressor. I quite literally got yelled at today by a colleague in my very own office. So I was kind of laughing to myself when it was happening, because I was like, I'm going to talk about wellness today. This doesn't feel very well. It's not very healthy. My psychological safety is not great right now.
Yeah. And that's important. Middle management is really hard. And those middle managers feel the pressure from both ends. So they are squeezed tight. And one thing I think that's important in middle management, you said communication. I always like to think about connection. Like, how do we
Yes.
connect with our upper management, the people that, we're leading, and building trust? So,
Mhm.
when I was in middle management, that was big. Your team has to trust that you're going to tell them what they need to know, when they
Yeah,
need to know it, and trust that you are advocating for them with upper management. So
absolutely.
that is
Connection is
so,
key.
yeah, it is. And sometimes I think connection is sometimes more important than communication. It comes first.
Yes.
People have to know
Yes.
you care.
100% agree with you on that.
Um,
Because if the connection is there, the communication will be. But you can definitely communicate without connecting.
Right, absolutely. And that's one of our pillars,
Yeah.
connection. And it was
Mhm.
intentional. It wasn't communication, right? But
No.
or collaboration, but really connecting. And I think when you talk about wellness, people want to feel connected, because if you're
Mhm.
connected in a time of chaos, you can still
Yep.
ride that ship, right? You can still
Oh,
run that
absolutely.
ship. If people
Yep.
are disconnected and we're communicating and collaborating, that ship's going to go down.
Yeah. Well, I mean, I
So,
experienced that today with my colleague where, we've had a bit of a rift in our work relationship and it's
mhm,
been slowly building back. And then today what happened, I was like, okay, so it's not real.
mhm.
Okay. We're not really connected at all. Okay.
Yeah. 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 And then how do you savage that relationship? It's, we always say it's having that courageous conversation to, radically shift things there. But yeah,
Yeah.
so these things are happening, day in and day out.
Yeah.
And once they start to fester and grow, then it becomes like an unsafe environment. It can
Yes.
become an unsafe environment.
Absolutely. Yeah.
So
And many people are very afraid of those little conversations, let alone the big ones. And
yeah.
so the unsafe work environment is a very real threat. And another example today, I had another nurse who she's kind of, um, um, you just never exactly know what you're going to get with her. If she's going to be calm or if she's going to be a little bit more upset.
Hmm.
Um, so I had a very small issue to deal with her. And I was just like, okay, gotta breathe through this one first just to see how she's going to take it. And I navigated it as carefully as I could.
Hmm.
And I think that we did okay with it. But,
Yeah.
it's still just like that connection. It's kind of a facade with her, where I am trying to constantly rebuild it, but it is such an easy thing to break again. So, and
Yeah.
that's personal stuff. Like, and I think I came from a generation where you leave work at home.
Yeah.
Sorry, you leave your personal life at home. Yeah,
Yeah.
that's what I meant. And you don't, in theory, you're supposed to be able to like disengage from all your personal stuff. And I think we're all realizing that's just not possible
Right. Right. Yeah.
unless you have like true like mental like issues where you can actually.
Yeah.
And I've been able to do okay with it for a long time, but man, I can't. Like I unfortunately bring home to work and work home.
Yeah. 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 No, it's a given, because we're individuals, especially in this world that's so interconnected and people have
Yeah.
access to you.
Oh yeah.
I always ask the question, how many hours do you work? Right? And you say, oh, 40 hours, 32. It's like, no, like mentally, like,
Right.
do you
I
shut it
wake
off?
up thinking about work and I go to sleep thinking about work. Ugh.
Yeah, yeah. So Heather, overall, and I think this is so like key and spot on right now. But what does wellness mean to you? Because you said you had an incident today
Hmm.
at work with a colleague, right? But I want to know what wellness means to you, and I'm asking that question because it's important that we understand that we
Mhm.
understand what wellness means to our colleagues, our leaders, um, because that person you had the interaction with may not know what wellness means to you. They may not feel connected to you, and that can be an issue. But what does wellness mean to you?
It's a great question. And I think if you're okay with it, I'll steal it and ask my own staff the same question at the beginning of some of
Absolutely.
my huddles coming up, because I think that that's a really great way to start a meeting and just kind of almost like weekly, just remind yourself because it can change,
Yes.
depending on what you're prioritizing. So For me today, wellness means, one, I have to stick up for myself if I am in a situation that is challenging my wellness. So I have to have healthy boundaries of saying you can and cannot say certain things to me. And then also, I think, again, going back to connection, wellness to me is seeking connection with people who fill your cup. So obviously for introverts, that's not the case. That might be go for a walk, which I think I kind of sit on both sides. I sometimes need, like, I've already gone for a walk today by myself. I just needed to like clear my head. And if it was nicer outside, I would have gone outside, because there's a lot of beauty to going outside and just breathing fresh air.
Yes.
So the introverted side of me is go for a walk, move my body in whatever way I can that's healthy. And then the extroverted side of me would be to connect with people who fill my cup. So I reached out to a colleague here, and just said, hey, I had a rough morning and I would like to just chat with you a little bit as friends. So we weren't able to connect today, but we put it on our calendar. It was really cute. It says like something along the lines of spend time with those who make the world a better place. Like she put a little invite on our calendar. So It's something I can look forward to. And I think that is a very good example of wellness. It may not be right here and now, but it's those little things.
Yes, I love that. I love that. And that's important to have an outlet, like
Yes.
the friend who put that on your calendar. And it's important that other people have that, and you know who you can go to say, I had a bad day and I really need some time to just, for you to help recharge me, right?
And it's not even to necessarily talk about the issue. It's just to be around somebody positive. Because if you don't keep that negative energy like in check, it will just seep in everywhere. So I was actually really proud of myself, honestly, to reach out to her, because even just like a year or so ago, I probably wouldn't have done that. I've had my times in my life where I just kind of eat it all up, and then it does not come out well. So I'd much rather be in control of when I have any kind of outbursts.
Yep. Absolutely. Absolutely. Awesome. If you had a magic wand and you can wave this wand and every organization, institution would, make nurse wellness a priority, what would that look like?
Oh, that's a great question. I think protected time is a big thing now. So obviously we're talking magical wand, so it could be like beautiful and big things, but I think I'm too practical for that. So I think what I would want is, and I mean, maybe it would require a magical wand to allow people to have protected time, not just for them to go to shared governance meetings, but maybe protected time for them to go for a walk and to get their breaks and to recharge in the middle of the day, because otherwise you get home and you're just depleted. So maybe like, I don't know, we all talk about that half-hour lunch break and then the 2 15-minute breaks, and it's like maybe you just need something else where it's like, hold on, I just need like literally 5 minutes. 5 minutes to take some deep breaths or do some push-ups or whatever works for you to refill. So I don't know, maybe the magical wand needs to land on all the nurse leaders to say, hey, just check in with your staff.
Yeah, for sure. I think it starts there, but also we have, nurses who can be their own advocate. I was talking to a group of nurses a couple of weeks ago, and they were saying, well, our leaders don't really care about whatever. I said, but what about you?
Yeah, it's true.
Care. You guys can create your own group and really lean on each other and support each other if no one's creating that space for you. So, taking bold moves as nurses too, because sometimes you wait for the leaders. Nothing really happens.
It's true.
So,
and I do have a nurse here, one of my RNs. She is really good about speaking up and asking things that it's, as the nurse leader, it's not that I didn't want to do those things. It's just, I didn't even think that it was an option. Like I didn't think about it, but she comes in with her own lived experience from the HR world, and was like, oh, could we do this? And then I kind of chew on it. Like, oh yeah, maybe we could do that. So now we're able to have like flex tours, and it's benefiting people a lot. And for the first time, because we are federal employees, for the first time in several months, we're having a little bit of morale boosting up rather than morale tanking.
Love it. Love it. And as a nurse leader, if you can talk to nurses who are, on the unit, taking care of patients, what would you say to them in terms of taking control of their own wellness?
I would say that in 5 years from now, you won't remember how much money you had in the bank, but you will know how your blood pressure is. You will know how healthy you are. So instead of picking up that extra shift or staying a little late, go maybe, if you can, go do something for yourself on your day off.
Mm-hmm. Yeah, I love that. And take a day off.
Yeah, take a day off. Yeah, because at the end of the day, like, it's not the rite of passage anymore to say, I worked 7 days in a row.
Mm-hmm.
It's not a hero move anymore.
Right.
It's more so like, yeah, I allowed myself to go get my nails done. I got my hair done. I sat and did nothing.
Yes, absolutely.
Because if you don't do that earlier on, you'll become like I am, where I actually really struggle to rest. Mm-hmm. It's like my mind knows that I should rest, but I just struggle to do it because I've been so busy for so long. Yeah. So I'm learning.
It's ingrained in you, right?
Yeah,
like
absolutely.
in your DNA. So it's really changing that. And I want to shift a little bit because I came to speak to your group of students at Quinnipiac.
Yeah.
Tell us a little bit about that program, why it was, you guys have the program, what you're doing, and why was it important to have me come and talk about stress management and emotional intelligence?
Oh, sure. So, so at Quinnipiac University, we have had in the past graduate nurse student association. I always forget what the A stands for. So they've had it in the past, but it kind of petered out. And I think the last time they had anybody representing that association was back in 2018. So the world has changed a lot since then. So thankfully, I have to give credit where credit's due. Dr. Bradley, who's she oversees the Graduate School of Nursing. And I think a lot of the other faculty, they really saw a need for supporting the graduate students a little bit more. So they sent out an email asking for graduate liaisons. So myself and I don't know if you want me to share her name, but there's a master's. So Becca, she and I work together. She represents the master's program and I represent the doctorate program for GNSA. So we are the official liaisons for GNSA. And so we have certain things that we have to do. But our goal is, again, going back to connection, to bring together the online community, because Quinnipiac allows, depending on what program you're in, a complete online program. I got my master's without ever having to go to Quinnipiac. I only went there when I graduated. So that's all great, but you don't really have that connection that you get when you're, in clinicals together or whatever it may be. So we are working on connecting the online graduate group. And so Becca actually attended something that you spoke at, and it was highly effective for her. I think and very impactful. So we talked with our group of students. There's about 13 people, which is pretty good for a brand new group that came to our first meeting. And we asked, what do you want to learn about? So they very quickly talked about connection and wellness. And then there's some AI discussion and things like that. So it was just a no-brainer for us to reach out to you to talk to our group about wellness. And I think that because our focus is connection, and that's part of wellness, it just made total sense to have you come and talk. So, and it was very well received. I wish that so many more people would have come, because it was just a great conversation.
Yeah.
But we'll get there.
It was really good. Yeah, they were really engaged. So that I really appreciated that.
Yeah, it's a good group.
Yeah, and it just shows that people are craving that wellness, that, just feeling whole, feeling good. And even being in the room and curating that environment just makes people feel good as well.
Right.
What is something that the CT Nurse Wellness Project, what can we produce in terms of tools, workshops, programs that you think will be beneficial to nurses in the field, and as well as, nurses, student nurses, graduate or even undergrad?
I think anything that's like tangible. So if it's like simple questions for us to keep in mind, or like just throughout the day to keep in mind, and it's repetition too. So it would be a lot of, like, I've learned this in one of my classes. It takes the adult brain like 36 plus times to learn something new. Like, we're pretty dense. And so we have to have it on repeat. So that's why I think if you're going to offer something for wellness, it needs to be kind of simple and something that we can hold, whether it's like in our hands or with our eyes. We can put it on our desktop, print it out as like a little thing to look at. And that way it's just in our faces all the time. And it would, something along like, have you stretched today? Have you been outside today? I don't know, something like that. It's just a reminder that it is okay to take care of yourself. And it doesn't have to be in some grand way. It can just be simple enough. I know that when I don't get outside for a walk, I can feel it.
Yes, absolutely. Absolutely. Awesome. Yeah, that sounds good. We are actually in the process of piloting a tool. It's called the When Well Micro Assessment.
Nice.
And doing that assessment will give you some action items. So
yeah, action is key.
Yeah, I will send that over to you so you can be part of that pilot and give us some feedback on it. But yeah, that's the point. So, we really want to serve as a central hub for awareness, collaboration, connection, and community, really to move well-being of Connecticut nurses forward in the workforce. So we are looking for everyone to be a part of it. And we want to be that hub where you can come and get tools, you can come and get the tangible things, you can, engage in the programs. And it seems like, nurses in Connecticut, they want it. Just by our launch last week, it's a lot of people are engaged. So I'm feeling really good about this initiative, the statewide initiative. So
awesome. Well, maybe it'll grow even bigger and beyond, because, it's definitely not just Connecticut.
Right. Yeah. And that's the thing too. So the vision for this, so I've been in the wellness space for a few years, and I've been doing a lot of programs, nationally, even globally, like globally. I'm outside of the US doing, stress management. And, when we did the summit, I was, that summit was like the launching pad to like, let's do a statewide thing. If we all concentrate on a state and we could be the model, that's the goal of this project, is to really be the model of nurse wellness, for Connecticut to be the state. Well, that's a big goal, but we're working on it.
You've got lots of hungry people. So if you can make something that's tangible, like we talked about, I think people will be knocking at your door.
Yeah, absolutely. Yeah, so that's our goal. But before we get out of here, I do want to do a rapid fire with you. Is that okay?
Sure.
All right. So just answer the questions. First thing that comes to your mind. Nurse wellness means
taking time to care for yourself.
I know I'm stressed when
my neck is flushed.
My go-to stress management solution is
going for a walk.
And what's one thing you have planned for yourself for 2026? How are you going to make a wellness shift in your life?
Focusing on my fitness, for sure.
Awesome.
Because I feel better for sure when I drop a little bit of weight.
Yeah. Awesome. Well, Heather, thank you so much for being here, being our first spotlight. And I look forward to collaborating with you and getting you some of those tools for your staff and your students.
Amazing. You're awesome. Thank you so much for what you're doing. It's a really, really special. So